If you've ever heard someone say that kidney stones are worse than childbirth, they might not be exaggerating. Today we're talking about renal calculi, better known as kidney stones, and renal colic. Kidney stones, medically called nephrolithiasis, are hard mineral crystals that form inside the kidneys. Nephrolithiasis are the stones themselves, whereas renal colic is the intense pain when a stone moves into the ureter and blocks urine flow. When the ureter is blocked, pressure builds up, the urinary tract stretches, and the body reacts with powerful muscle spasms. That's the pain. Why do kidney stones happen? Risk factors can be modifiable or non-modifiable. Modifiable factors are things such as low water intake or dehydration, high salt or oxalate diet, including nuts, spinach, chocolate, and tea, high animal protein diet, obesity, and a sedentary lifestyle. Non-modifiable are genetics, family history, male sex, prior kidney stones, and certain metabolic disorders, such as gout and hypothyroidism. The most common stone is calcium oxalate, which accounts for 75 to 80% of kidney stones. It's followed by uric acid and calcium phosphate. The classic picture is sudden severe flank pain, colicky pain, which is pain that comes in waves, pain that radiates to the groin, testicles, or labia, restlessness, nausea and vomiting, hematuria, which is blood in the urine, urinary frequency or urgency, painful urination, and in rare cases, fever. Think infection, sepsis, or emergency. Some conditions similar to renal colic include appendicitis, ectopic pregnancy, testicular torsion, pyelonephritis, abdominal aortic aneurysm, gallstones or biliary colic, and musculoskeletal back pain. If you're dealing with an older person, especially if they're sweaty or pale or having tearing pain, always rule out abdominal aortic aneurysm. Prehospital paramedic goal is to control pain, nausea, and transport safely. It's important to get a detailed history, pain assessment, vitals, and rule out other red flags like fever, sepsis, and shock. The treatment would include analgesia, usually opiates for severe pain, and non-steroidal anti-inflammatory drugs if available, antiemetic for vomiting, and IV fluids for hydration. These are conditions that would need transport as they need imaging and medical therapy. It's especially urgent if there's fever, signal kidney, unable to pass urine, severe uncontrolled pain, or the person is elderly or immunocompromised. So finally, to summarize, renal calculi is the formation of a stone, whereas renal colic is the sudden onset of intense flank pain that occurs in the context of renal calculi.